All right, guys, my name is Dr. Rose. I'm with Rose Chiropractic and Wellness. I just want to say thank you so much for joining our ADHD talk, which I think you guys are going to get a lot of really good information out of it, and I definitely think your families are going to benefit from it. So let's go ahead and jump into what we're going to talk about tonight, which is obviously ADHD, but we really need to dive into some of the medications, what ADHD actually is. Are there alternative treatments? Are there anything else you can do to help your child out? Which, first and foremost, absolutely. But let's go ahead and start and jumping in and seeing what this is all about. So, first and foremost, what is ADD? What is ADHD? Is it a disease? Is it crossed wires? Is it a mental disorder, or is it a chemical imbalance? Well, more than likely, it's that chemical imbalance, which is more the realistic thing behind ADHD. You know, we use these drugs to help balance the chemicals in our kids' brains. So that's probably the most accurate approach, is there some sort of chemical imbalance there. And stimulant drugs are used to treat ADD, such as Ritalin, Adderall, Concerta, other amphetamines. These boost levels of both dopamine and a message-carrying brain chemical associated with activity, serotonin, and associated with a sense of well-being. So these drugs help balance out the chemicals in our child's brains. Now, starting off with these drugs, they really got a lot of attention back in the 1990s, so much so that you were seeing it in videos, you were seeing it in Newsweek, you were seeing it in newspapers. So what I'd like to do is just start off first by going through this article that's titled Mother's Helper. So in this article, it's talking about how it's another medication morning at Winnebago Elementary. Nearly a dozen students scrambled to the office for their Ritalin. A decade ago, Wagner remembers only 2 students lined up for Ritalin. And this is the approach of a principal of this school. So, you know, definitely ADD, ADHD, these sensory type issues are on the rise for sure. And this is back in '96, 1 million kids were taking Ritalin. Fast forward to 2016, I bet you it's in at least the 3 or 4 million. Now, working through this article too, it is a powerful drug and one that the U.S. Drug Enforcement Administration has classified as a Schedule II controlled substance in the same category as cocaine, methadone, and methamphetamine. So that last part's kind of important. These drugs are in the same category as cocaine, methadone, and methamphetamine. So these are very powerful drugs. The rate of Ritalin use in the United States is at least 5 times higher than the rest of the world. In this article, it goes on to say that Dr. Jensen says, "I fear that ADHD is suffering from the disease of the mouse syndrome." So it's an easy diagnosis. I'll just go ahead and say that. And there's a drug for it. So it's very accessible for your child to get Ritalin, especially when you have teachers pushing for it. But just keep in mind, it's in the same category as cocaine, methadone, and methamphetamine. So pretty powerful stuff. You can go ahead and go see the usage here from 1990 to 2000. Definitely gone up. Once again, this is 2016, so I'm sure the usage is way more than what we're seeing here. Spending on drugs primarily used to treat ADD. 369% of kids under the age of 5, which I want you guys to remember that age of 5 mark. As the number of kids taking 1 or more prescription medicines to treat behavior-related conditions hit nearly 9%, for those children taking at least 1 medication overall, according to the new data released today at the Medco Health Solutions, Inc. 2004 Drug Trend Symposium. So a 369 increase usage in kids under the age of 5 for these drugs. Pretty crazy. Under the age of 5. Okay, going through this article again, it's saying that according to the DSM-4, a child must have 6 or more of the following that persists for 6 months minimum to be diagnosed with ADHD. The DSM manual is your diagnosis manual. It's basically what goes through and tells you if you're applying a drug to a certain person, what they need to have so you can give them that drug. So this is your diagnosis. So first off, we have to have inattention, pays little attention to details, makes careless mistakes, has a short attention span, does not listen when spoken to, does not follow instructions, has difficulty organizing, avoids tasks that require sustained mental effort, loses things, is easily distracted. So this is the inattention part of ADHD. Kids have to get medication. Going through this list, I can definitely see a couple things myself I struggle with. I wouldn't classify myself as ADHD, but you can see how easy it is to wind up on this list. Now let's go over to the hyperactivity side. Fidgets, squirms in seat, leaves seat in classroom when remaining seated as expected, runs about, climbs excessively, has difficulty playing quietly, acts as if driven by a motor, talks excessively. Remember guys, we're talking about kids under the age of 5. I can guarantee you that if you have a child under the age of 5, they're going to do some of these things. Do they necessarily need medication for it? I don't know. That's something you should probably think about. And here comes the impulsivity side. Blurts out answers before questions are completed. We've all sat around and watched Jeopardy. We've seen our game shows at home. And what do we do when we know the answer to something? Well, we blurt it out. The kid's going to do the same thing. Is that necessarily ADHD? I don't know. You have to really think about that one as well. Now, going through the rest of this article here, researchers believe that methylphenidate juices up the central nervous system. Methylphenidate is the primary chemical within Ritalin and Concerta. And what its target is right here at the end of a nerve cell. So these are receptor sites. This is your nerve synapse. And basically what's going on is there's some sort of chemical imbalance in here. For some reason, that dopamine and all that's not being absorbed correctly, and it's getting reabsorbed back in that synapse. So we're having a lot of chemical problems within the brain. Going through the rest of this article, it goes on to write how 9-year-old John White, as he asked to be called, experienced the worst aspects of Ritalin. Soon after his first dose, John began losing his appetite. He stopped sleeping. He would explode with laughter 1 minute, shed tears the next. It was scary, says Sarah. Sarah is his mom. Then the facial tics developed, eye tics, mouth tics, vocal tics, hair pulling habit, one that continued months after she pulled him off Ritalin, left a bald spot on the back of his head. Sarah enrolled him in the biofeedback therapy and schooled her son at home for some months. 3 years later, John is thriving, Ritalin-free. We choose to look at him as just a very bright child, says Sarah, with some quirks. So I'm going to stop right there and go ahead and open up the Facebook side of this so we can talk about this. Post your comments, post your questions, and then we'll come back to this.